I would like to welcome back to the show Dr. O. And today we're talking about flu season. As you're aware, News for Jacks has been very active, doing all different types of segments, educating everyone out there in the community about the flu and different things like vaccinations and eating right and sleeping and all that stuff. Well, Dr. O has a background in integrative medicine, and today we're talking about food and diet and how that may help. One in particular, chicken soup. You hear about it all the time and it's passed down generation to generation. So Dr. O, welcome back to River City Live. So let's start with that one. Chicken soup, does that really even help with the flu?
Thank you, Mark, having me on the episode again. And hello, everyone. And chicken noodle soup for the soul is a kind of saying over the years. I think it's very important, and we need to realize all these nutrients in our kitchen, in our homes, available for us. So speaking of the chicken noodle soup or chicken soup for the cold and flu, when we boil chicken, ideally whole chicken, and the broth creates all the peptides from the bone of the chicken, it's a very vital nutrient for the gut lining. So for our digestive tract to be totally sealed, and for that to optimally absorb the nutrients, we need to tap into amino acids. And chicken soup, somebody's sick, is not feeling like eating, you're giving a micronutrient, which is loaded with the protein and amino acid peptides. So, and chicken soup also has hydration and a warmth. And a lot of conversations were out there speaking of drinking daily green tea or warm drinks to wash out the viruses to our stomach. So before virus can penetrate into our respiratory tract from our nasopharynx. So drinking small amount of sips of warm fluids washes it from the upper respiratory tract into the stomach, where we have the stomach acid, which is designed to sterilize our food and also start digesting. So I think daily exercises and sipping warm water or room temperature water or having a broth and chicken broth, it's a very good practice to give us nutrients, amino acid peptides, and hydration. And if you don't feel like eating, getting some amino acids, micronutrients in our system.
That's why I love talking with you, because you have a background as a medical doctor, but also integrative medicine. So right away, you tapped into the science, talking about peptides, amino acids, how it's absorbed in your stomach. So again, it's just an eye-opener. So there really is something to chicken noodle soup. Let me ask you another one. Vitamin C. Everyone swears by it. How much do you have to take? Does it work? Does it only work if you take it before you get sick?
Vitamin C improves wound healing and injury healing. It also improves our collagen, soft tissue to heal. In terms of exposure to viruses, they invade our, soft tissue, nasopharynx, our mucous membranes. Vitamin C is one of our first vitamins to go to for soft tissue healing, injury healing, improves our immune system also in a different biochemical pathways. In terms of how much vitamin to take, and I think best source of vitamin C is our food. We need to get enough vitamin C through fruits and vegetables. There's nothing better than primary prevention rather than just going to a bottle of supplement or drug. Or in terms of how much to give, in daily intake of vitamin C in a regular vitamin for children, like 80 milligram, or people just go up to 250, 1,000. It's really excessive of anything may not be a good thing, may increase some of the kidney issues and the kidney stones in some people. So I really think that it's most important to take it in a natural form. If a person has a chronic illness and their need for these micronutrients much higher, and those are the patients that we recommend those in a fat-soluble form, liposomal form, and easy to absorb form, and that's for our functional integrative medicine patients.
So we covered chicken noodle soup, deemed it effective, vitamin C, you mentioned tea as well. Is there anything that we're missing that's kind of like a superfood or nutrient that we should make sure that we're consuming during flu season?
Yes, and quercetin. And quercetin is one of the ingredients in garlic and onion. Quercetin is for many, many years known in the natural world as an anti-inflammatory. It's important for us to decrease our inflammation in the body. So if we are exposed to an infection, our body is in a neutral state. It's not like a hyperinflamed state. So it doesn't get even more off-killed when we catch flu or SARS virus and any of the viruses going around. And it's important to also increase bromelain. It's another superfood. It comes from pineapple. And bromelain is also anti-inflammatory. And quercetin and bromelain is easily found in your health food store. And I also have a product over the years we very successfully use it. And also sometimes as a decongestant. Stinging nettles could be a very good decongestant and to decrease upper respiratory droopy, runny nose, and congestion.
All right. Well, Dr. O, thank you so much for your time and all your information. I learned a lot. I'm sure everybody at home learned something as well. We really appreciate all your time and your expertise. If people want to learn more about you and your practice, where can they go?
They can go to Dr.O.Jax.com or DrOzdemir.com or our new telemedicine platform, obtainhealth.com.